So I am thrilled to introduce three experts in the field who are going to be talking about MyChart. So I'm going to let them introduce themselves first and then get started. Christine, would you like to start?
Sure. Hi, I'm Christine Cetrangol. I'm one of the IT directors here at Mount Sinai, and I've worked at Mount Sinai for 17 years. And one of the areas I oversee is our patient portal. And I used to be a nurse here, so that's my background. And I apologize for my voice. I don't usually sound like this. Oh, Jillian, you're on mute.
Thank you for joining us, even with maybe not feeling so great.
Oh, no worries.
Mallory, would you like to introduce yourself?
Sure. Hi, everybody. Thanks for joining today. My name is Mallory. I'm a nurse practitioner here at Mount Sinai. I've worked in the Gynecologic Department now for about 5 years, working with different doctors, Dr. Kolev, Dr. Blank, Dr. Cohen, Dr. Zeligs. And I'm also the clinical program manager, and I help oversee some of the day-to-day clinical issues here at the cancer center. And I'll talk a little bit about when it's appropriate to use MyChart, when it's not appropriate to use MyChart. And I look forward to talking with you all.
And Mo?
Hi, my name is Mo Paolini. I'm the patient representative on site at Chelsea. Maybe we can talk at the end more about what patient representatives do, but in this context, I'm definitely a resource for patients to connect you with your care providers, with different departments, and certainly a resource to help you when you're navigating MyChart. If you're here, at the center and you need help with things, you can certainly always ask for me. I can do my best to help you get where you need to go on the app, or just facilitate that communication and that understanding of that resource of MyChart.
Perfect, thank you. So I think we're first going to get started by a little tip sheet that Mallory made in terms of when to use MyChart and when not to. So I'm just going to pull that up for you.
Thanks, Jillian.
Of course.
Okay, so I'm just going to get right into it. To be honest, my preferred method of communication, if we can't meet face to face, if it's not in the office, I do think MyChart is very useful. And the reason being is because if I'm on Epic, or say Dr. Blank is on Epic, or somebody from the care team is on Epic, we can always check it, as opposed to you, a patient, calling in, waiting on the phone. You get sent to the call center, then they send a message to the nurse. There's sometimes a lag there. So it is my preferred method of communication. However, there are certainly times where a phone call is much more appropriate than using MyChart. So we'll just, before I go into the when and the when not to use it, I just want to say any message or anything that is sent via MyChart, so a picture, FMLA forms, any kind of attachment, becomes a permanent part of your file. So any message you send to Dr. Blank, Dr. Kolev, Dr. Zeligs, Dr. Cohen, it can be seen by your doctor. It can be seen by anybody who's looking at your chart. I just wanted to put that out there. It's monitored by our staff when they're here. So that's during office hours, typically from 9 to 5. Sometimes we'll have, a nurse that's here early. It might be 8:30, but it's within that typical office hour range. It's not checked on the weekends typically. And so any urgent issues or concerns, any emergencies, you should always call our office. And then just an aside, I don't know, maybe Christine will touch on this at some point, but alongside with MyChart, you can, in addition to messaging your providers, you'll see your test results pop up on there automatically now with the new CARES Act that was instated over the summer. I don't know if you all have experienced that, but now test results are being released automatically. If you don't want to get those test results automatically, just let us know and we can always decline the auto release. So a provider can call you or send you those test results via MyChart with a message saying that they've been reviewed. But going forward, okay, so let's just talk about when to use MyChart. From the clinical perspective, this is when it's appropriate to use MyChart. Say you need a prescription refill that's not urgent. So say, you've got 15 days left on your blood thinner and you need it to be refilled. And say Dr. Blank's team has been the team that's been refilling them for you. Please send a MyChart message and we can do that. And you can certainly call our office as well. But MyChart would be an appropriate time to reach out to us. If you have any FMLA forms, if you're requesting a letter, a doctor's note, any other kind of documentation, let us know via MyChart. We can also send it back to you via MyChart. If you need to reschedule an appointment, if you want to reschedule a surgery and it's not within a 24-hour period, or your infusion, you can send a MyChart. Just in general, any updates about your condition, or say you have a family member that uses your MyChart on your behalf and they want to send us an update, that's fine, as long as it's not an emergency situation. Any questions regarding like minor symptoms related to surgery, say, I had surgery 4 weeks ago and I had a little bit of spotting, that's okay to MyChart that. Versus, I had surgery last night and I'm home and I'm profusely bleeding. We're not going to get that MyChart in real time. So basically anything that you would be okay waiting for a response. We do try to give a quick turnaround time, but it's not always possible. If, we're seeing patients in the clinic and it's a very busy day, there may be a delay on that. So that being said, these would be times where MyChart is not appropriate. Any in-depth questions regarding your treatment, diagnosis, or side effects that you really want to speak to your doctor about, MyChart's not always the best route. That would maybe be more appropriate for us to schedule a phone call, do a video visit, something like that. If it's just a general question, that's fine. But I would say anything that requires kind of a lengthy explanation, or that you very urgently need to know, give us a phone call. Of course, if you have any debilitating or concerning emergency symptoms like pain, vomiting, bleeding, shortness of breath, you need to give us a phone call. Any severe or worrisome side effects from treatment, say you can't stop having diarrhea, you can't get out of bed, MyChart's really not appropriate. We would need to know like as soon as possible. And with that goes, if you're considering going to the emergency room, always call us beforehand. We really don't want you guys going to the emergency room if it's not a true emergency, because, risk of COVID, risk of infection, going to the emergency room is just not a good place for our patients to be. And if we can intervene and maybe send someone to your house or send you to the oncology care unit, we would like to do that. A sudden status change. So say all of a sudden, say you fell, or say something happened where you dizzy, you don't feel like your normal self, give us a phone call. This one's very important. Questions regarding surgery within 24 hours of the time you have to be in the hospital. Say you've not gotten a call about what time you have to be there. Say you have a question regarding like a bowel prep or some kind of question before surgery, and you got surgery the next day. Please give us a phone call. The call center knows that they need to route that phone call to us, because it's important that we answer that question before your surgery with your doctor. And then of course, any urgent overnight or weekend issues. Say it's like a Friday at 3 p.m. and you think you may have a urinary tract infection, give us a phone call, because we're not going to be open on the weekend. So we'll probably direct you to go to urgent care or your PCP. Also over the weekend and at night, our phone line gets connected to an on-call physician. So if there's really truly an emergency or anything that needs to be followed up on, someone will get that message and somebody will call you back. And this tip sheet will be circulated by Jillian. So please, if you have any questions, you can always reach out to me. Hopefully this was pretty clear of when to call and when not to call and when you can use MyChart, but does anybody have any questions?
And if you do have questions, feel free to just ask. You don't have to like raise your hand or anything, because Zoom is a little bit more difficult to see.
I did want to add, so the way that our practice works is that each physician has a nurse and a nurse practitioner that they work with. Those physicians have what we call on our end, it's called an in-basket. So it's almost like an email through the Epic system. And on that's where we see when you send us a MyChart message. So say, you know, I work with Dr. Blank. I can see her MyChart in basket. So when you send Dr. Blank a message, I can see it and I can respond. You can't always respond to me for some reason, but if you respond to Dr. Blank, I'll be able to respond to the message. You can just say, hi, this message is for, you know, Mallory, or this message is for Molly, or, you know, this message is for Beth. We can see those messages. So we'll make sure that they get to the right person.
Thank you so much. And this was included on the email blast that was sent this morning, but I'll also make sure that it is circulated again, just in case if you didn't see it for some reason.
Oh, and I'll add one more thing, sorry. If you sent a MyChart message and you have not gotten a response from us within a day, please give us a phone call. That's not our goal. We try to respond to messages as quickly as possible, but sometimes things happen and we're not able to.
So again, I'm Christine. I'm in the IT department. I'm one of the directors and excited to speak with you guys about MyChart. You're going to hear me refer to it as MyMountSinai. That's what we call MyChart here at Mount Sinai. MyChart is just like the system. So we're going to go over what is MyMountSinai, how do you create an account, how do you access your account. I'm going to do a little bit of a demo from the phone and give you some information in case you need some technical support. We're always here to support you. So, oh, and also it was stated before, but feel free to interrupt me if you have any questions. Just speak over me. It is okay. I sometimes tend to talk fast and want to make sure if you have any questions, you don't forget them. I am going to have to hide your faces though, so I can see my screen. All right, there we go. So as you probably already know by this point in the call, MyMountSinai is our patient portal. It's where all of our patients can access a substantial amount of their medical record and really be at the center of their care. It's a communication channel. It's a place where you can make requests, accept requests, and has a load of features, both obvious and not so obvious, that we're going to go through. MyMountSinai has over 1.3 million active patients right now. It is very heavily used, and there's a lot of support both for patients and staff if needed. So if you do have questions, you know, definitely take advantage of what I'm going to get to towards the end of these slides so that, you know, we can help you get access and understand, you know, how to use the app, because there's a plethora of things that we're going to go through that you can do to really you know, connect with your, you know, care and providers. So from a connection standpoint, you can access MyMountSinai through a website or an app. This is similar to other, you know, hospitals you may go to as well. There's multiple MyChart apps sometimes. Ours is just called MyMountSinai, which is why sometimes it can be a little bit confusing. If you don't have an account, everyone who is a patient at Mount Sinai is entitled to an account, and that goes for all ages. Since we aren't talking about pediatrics on this call, I'll focus on the adult accounts. Any adult can receive an account, and you can allow your family members, or your family members can allow you to have access to your account, and we refer to that as proxy. You can give them that proxy access so that, you know, for example, my husband and I are connected so that we both have access to our account. When you sign up, you are given a few different ways of getting a code. Codes can be given to you at the time of a visit. And they can be given to you by the front desk staff. You may get a text or an email sent to you with an activation link. If we missed you there, an after visit summary would also have the link on it. And if your practice is using a kiosk to check in, you can sign up in real time. So there's a lot of ways when you're at the office to get the code to sign up. And the reason being is we can't provide codes over the phone for HIPAA purposes, right? We need to make sure this is you, you are getting the code, and we are matching the person to the code. However, if you don't have a code and you're at home right now and want to try to sign up, after we chat here, there is a self-sign-up tool on the website and app that can be used to try and sign up yourself. And what this does is it puts you through a process to confirm your identity, similar to if you were, signing up for, almost like a credit card or something like that. It uses that background checking, the same process. And if, worst comes to worst, you don't meet the criteria, perhaps we can't match you in the system. Behind the scenes, you will have to reach out to your provider for that code. Also, after a visit is complete, we do as well send a code to a patient. So tons of opportunities to sign up and get yourself activated if you aren't already. All right, so I mentioned a little bit before, Mount Sinai can be accessed through a website. It's supported in all browsers. You don't have to have a phone to use it. Of course, the app is a little bit easier when you're doing things like video visits and some of the telehealth experiences, but it's completely fine to use a web browser. We also have the app, which is supported by both iOS and Android, so it doesn't matter what type of phone you have, you can download that app. If you don't like to download apps, you can also access Mount Sinai through the the web on your phone as well, just like you would a computer. Of course, apps are great because you get things like push notifications. It becomes more interactive. But if I know a lot of people, they don't like downloading apps, they don't have room on their phone. Maybe they share their device with other people in their house. You can also download it on an iPad as well. Another great advantage right now is we have Mount Sinai available in multiple languages. So we started off with Spanish I think that was right before March of 2020. And this past summer, we made Mount Sinai available in 3 additional languages, simplified Chinese, Arabic, and Russian, to help our very diverse population of patients. And next year, our target is to add another 4 languages based on the frequency of use at Mount Sinai. So we're very excited about this. So that's just brief background. I think there's more proof in the pudding, and I'm going to do a live demo where we talk through a lot of what you see written here. So I'll just show you what it looks like and where you go to activate and log in. We'll go over what your news feed is, the menu, talk about how to find care, look at your past and future appointments, what the messaging activity looks like, how to request a refill, test results, a little bit of information about COVID, and also a part that, probably seems silly, but your communication preferences. And I'll get to why that's important later. I am going to just show you the last slide here because I'm sure we're going to share these with you after, but this is the number for technical support if you ever need it. And there's also a ton of FAQs on the website, tip sheets, a lot of resources to help you actually utilize the website, including videos, etc. So any questions while I'm switching over devices? Okay. If you see my son for a second in the background, that isn't intentional. All right. No. All right. So Here I'm already, I already have the app downloaded. Oh, let me get rid of that guy. So it looks a little bit different, but if I needed to sign up, I would have this sign up button. And this is where I spoke about entering a code, and the code you are given, you would enter here, you'd enter your date of birth and your zip code. And upon the next screen, you would just make a username and password and put in your email. And it's really that simple to sign up. So I'm just going to quickly log in here. As you can see, I had enabled Face ID. You can enable a passcode, or you can just sign in as you would, your username and password manually, whatever you're most comfortable with.
Christine, can I just jump in for a quick second and just share something that comes up pretty frequently with patients that I talk to that maybe got a code at some point, didn't set up MyChart. If you change your mind, you don't have to dig through your email and find that old code. We can generate a new one.
Mm-hmm.
Can talk like they can generate a new one anytime. That's something that's just kind of come up kind of recently for me with patients. So I just thought I'd throw that out there about if you don't have to have that first code that you were given. We can
Great point. No, thank you.
time. And that's something I can help with too. If you ever reach me, I can go into Epic and I can send you a code. So
I have a question. It's Nancy. But if you want to use that code, can it be used?
It depends how old it is. They do expire eventually.
Okay.
So it's, always best if it's more than 90 days to reach out to your practice.
No, I was saying like if I forgot about a month and I like, oh my God, I didn't use the code.
No, that should be okay a month.
Okay.
Yeah. All right. So this is your, I'll call your main page here. No matter if you're on the website or the app, all the components are pretty much similar as I go through each of these pages. I am showing the app right now, mostly because I think it's the cleanest version and very easy to, navigate. So this is our main page. You could see here, I have some quick buttons at the center of the screen to get to my appointments and visits, my messaging activity, test results, and medications. We'll get back to that in the menu in a second. As I scroll down here, we call this your news feed, similar to social media, right? It's the top of the list. What is, what's coming up, what's on the horizon according to, my account. And this is personal to me. So for example, in this account I'm in, I have an appointment coming up where I could eCheck-In, I could view some details. I also see here that I'm overdue for my flu shot, and I have a little announcement here that there's a research study that I may want to participate in. And I could easily dismiss these or ignore them. They really don't have any impact if I ignore them. So we'll get back to checking in a little bit. I wanted to move over to talk a little bit about, I'm just opening this up, perfect. A little bit about the menu. So the menu is, in some respects, overwhelming. There's a lot here that can be done, and there's a lot to unpack. So the one great thing that's here is there's a search bar. I don't know about you, but I always forget what things are called, where they are. So if you ever, you're just like, oh, all that I want to do is just like, find my medications. And, it can narrow down that menu for you and search based on what it's called and any keywords that we put behind the scenes. So I always like to call that out. So the menu is just filled with various activities and functionality that you can connect out to as a patient. I'll talk through, some of the main areas and highlight the most commonly used features, over the next few minutes. But if there's anything that, you specifically want to talk about or, feel like, oh, I wish I knew more about that, please feel free to ask. because that's why I'm here. So the first thing in the menu I'm going to talk about is finding care, right? That's a big part of what we do on our app is, how do we find our care? This may mean making an appointment. It could mean looking for a provider. So this section is probably one of the top used sections of the app in general. Here you can link out to the virtual urgent care service, which is a service where you can get a video visit with what we call an on-demand provider. And that's I think it's 8 to 8, or I believe are the hours at this point. But it's oop,
Hang up and dial 911. Your call may be recorded for quality and training purposes.
that wasn't me, right? We're good. Okay. All right. So it was actually really good because I was talking about urgent care. So for for other types of care, you can of course make an appointment, and I'll jump into that in a second. You can find a doctor at Mount Sinai. So this means a doctor maybe that you haven't. I'm looking for a dermatologist. I'm looking for a gastroenterologist, and that would link you out to our Find a Doc. You can also see, of course, your care team. And find some information with our maps around Mount Sinai in the last two activities. So if I jumped into making an appointment, you could see here that, if I was established with a provider, I would be able to see them here. And, or if I wanted to find a new provider, I could come here and try to book with them. So this is a great place to go to, make your appointments and manage them. The care team is a nice activity because you can also come here and, see who your providers are. I have this problem when I go to other providers and they ask me the name of my doctors. I'm like, I don't know how to spell it. I don't know what they are. So I often actually use that when I go to other doctors so that I can give them the correct spelling and information for my doctors. So that is the gist of finding care and making appointments. The next area I'm going to talk about is a little bit about past and future appointments. So if I go back to the main page and go to some of those key buttons that I was referring to before, you could see here there's a button called Appointments and Visits. And I see some questions coming through. Let me make sure I answer them. How do you get a Oh, this is actually a very common question about how do you get information corrected and how do you add information. So getting information corrected has to be done by the provider's office. MyMountSinai is a reflection of your patient record. So we get that question a lot, is can you update this for us? This isn't exactly right. I had the surgery this year. It says that year. So you would have to, shoot a message over to your provider's office to get that updated. If there is anything, that is incorrect, that can be easily updated almost in every scenario. If you ever wanted to update some information, there are certain areas where you can actually update that your provider can review and approve. And we'll get to that in a minute, actually maybe a couple minutes, and hopefully that answers your question. So as far as appointments and visits, this activity, you can see all past and future appointments. Within the last couple of years, not only do you have your after visit summary that you can review, you can also see your provider's notes in most scenarios. Robin, you have a question?
Yes, I do. What happens if someone is incapable of using MyChart, whether they're an elderly person and doesn't have a support staff, whether they're visually impaired? Is there an old-fashioned way of doing this also without using MyChart?
I mean, I don't want to speak for the practice, but I think, most likely the old-fashioned way is calling the practice directly and speaking to the care representatives. I will say if you do have issues visually and any hearing as well, the app does use screen readers, and it is accessible as well, with different tones for vision. Don't think that answers you fully, but I'm not sure if Mo, you would agree that reaching out to the practice would be best.
Sure, and even just the call center in terms of like confirming upcoming appointments and things like that. And then come in for appointments. If we're talking about like results, you can always, when you come in to see the doctor and you have labs drawn, they can print those for you and send them with you when you leave, and they can print out, your after visit summary and any results that you ask for in that moment. You can always, request your records at any time if you want like a larger. We can facilitate all that here or by calling your provider's office, certainly. If that answers more of your question.
Thank you.
Great. And I did see another question come through the chat in reference to of all appointments being included. This answer probably isn't the best one. It's more technical than practical, but in our current state at Mount Sinai Health System, our systems are not, they don't all talk to each other yet. It's probably the easiest way to say it. We're getting close, which is exciting. We're the most connected we've ever been in all my 17 years here. But that is the main reason why you don't see something such as radiology on MyMountSinai, which is very unfortunate, and personally can't wait to correct in 2024 when that occurs. As far as your PCP not having access to MyChart, MyChart is a patient portal, so they wouldn't necessarily have access to it. Do you mean that they're not connected, like where you can't chat with them, or
I mean that they don't have access. In other words, my PCP works for One Medical, and the bosses apparently have access to MyChart, but not the individual doctors. And the reason I have a doctor from One Medical is because I couldn't find an available PCP from Mount Sinai in any of the practices for the last 2 years. So, but I don't understand, because I go to a gastroenterologist and she is affiliated, but she has access directly to MyChart. So this is why I don't understand how one doctor who's affiliated but another doctor doesn't have physical access. And the other question I had is, if you're talking about the future and the improvements to MyChart, are they going to be able to do as other portals do for individual practices and different types of medical care? Are they going to actually be able to upload your actual images, not the just test results, but the actual images from various CTs, MRIs, various radiology reports? Because I go to other, Weill Cornell, for example, you can absolutely upload your results as well as the images so that you can send them to your doctor or additional doctors for reference specialists. So is that something that's also on the drawing board for the future of improving MyChart?
Yeah, let me answer those in order. So the first question you asked was about One Medical, and One Medical is indeed affiliated with Mount Sinai, but they are not Mount Sinai employees. And again, this is one of those answers which is probably not the best answer, but more technical.
Okay, but my gastroenterologist is not an employee of Mount Sinai either. So
there's, again, not a technical answer. It's the difference of an affiliation versus using our system, right? So One Medical doesn't use the system. Meaning,
okay, but my gastroenterologist, but what you said was that they're not employees, but the gastroenterologist is not an employee of Mount Sinai either, but she has access to MyChart.
Okay, so what it boils down to is that they don't use Epic, which is the medical record. So it doesn't matter really what the status is. It all comes back to your patient record. So again, I hear your frustration and get why it seems disjointed. But because One Medical does not use the same medical record system as those other affiliated Mount Sinai providers, it isn't connected. So that's the answer to your first question. Your other question around radiology and being able to upload, you can today access your images on MyChart, MyMountSinai, for radiology and cardiology. You mentioned uploading. Did you
I'm sorry, you
mean-
said, excuse me, I don't mean to interrupt, but I mean, you're just saying something that contradicts my own experience. That's why I asked the question. I was in the hospital in June. I had several tests. There is nothing that you can upload of the images. Either I'm got an old version of my chart or something, but there are no images that are in there. So that's why I'm confused. By the way, I don't know if you said it, but one of the good things about my chart is that you can actually link up with other hospital facilities. And if they're, I don't know how it's done, but like Weill Cornell, I'm able to upload stuff from them, and also NYU Langone. So if you can specify, and that's a big help to be able to do that, to add it to your chart. But no, there are no images on here in my chart for tests that I've had from radiology and all. So
Sure.
yeah.
So if I can clarify and maybe finish the answer.
Sorry.
It's okay. I just want to make sure you get the full picture. Today, we have many systems at Mount Sinai. So I had mentioned earlier that not all systems speak today, which is unfortunate and annoying as a patient and as a staff member too, by the way. So we feel your pain there as well. But obviously much more impactful to a patient. So those systems don't all speak. We have several radiology systems, several lab systems, and I don't want to bore you with the technology difficulties behind that. So we 100% do have specific radiology images and cardiology images. I don't know what you had at your hospital stay, which could be the differentiator, right? It could have been a system that isn't available, most likely isn't. The goal is to get all of those systems connected. However, again, not to bore with technical pieces, not all systems are capable, right? They're too old, they're outdated, and we're working through those as we've merged with many different hospitals over the last 8 years, and it's still occurring today. So that is how it works.
I also just want to I'm just going to be mindful of everybody's time. It's 12:43, and Christine, I know that you created a big presentation. So I think, Marlene, if these are other questions, maybe we can get to these at the end, because we only have 15 more minutes.
Okay, no problem.
Everybody has to go.
No problem. Thank you.
More than happy if you are you're looking for something specific, that number in the PowerPoint, just like your doctor's office, they're staffed to take questions and report them to the technical team, who can actually look and provide you with information to kind of ensure that you're seeing things correctly. So feel free to, reach out. That's why we're here. So just to pop back over to past and future appointments, here's where you can review your notes and after visit summary from your provider. And you could see here up at the top, there's a future appointment here where I could, eCheck-In, I could even cancel potentially. And what checking in here does, it allows you to do some of the required steps prior to your appointment. You can sign, update your insurance, confirm your medications and allergies. If you have any questionnaires, that's where you would, complete this here, as well as signing documents. I'm not going to run through it again, just for the sake of time. I want to give a few minutes for you guys to ask questions at the end. Again, you also have a link out here if you wanted to schedule an appointment, just like we saw on the previous screen. So the other area I want to touch on is messaging. From here, this is our messaging center. In your messaging center, you could see all your previous conversations that have either been alerts sent to you or messages from your provider or their staff. You can also create a message. Here's, and I apologize, I think it was Marlene had mentioned you can connect some of your accounts to other Epic users. And again, Epic is just the medical record that we use. And here's where I would say, oh no, I want to talk to my, Mount Sinai provider, not my NYU provider. And I can go in here and ask a question based on, one of the choices that you could see. So I can go in here and message my provider, enter a subject, send it to them. I could even, add an attachment if I really wanted to. Perhaps I, needed to send them a form that needed to be updated. I could send it all through there. As far as the other activities I want to highlight, also the medication area. Here, if you needed to refill a medication, you can come here. I know someone asked before, how do you update your own medications or information? So this is one of the areas that I was going to highlight that in. You can see here that it says that this patient has no medications on file. So I can come here as a patient and say I went to another provider and I haven't been to my Mount Sinai provider yet. I can come in here if I wanted to and say, oh, I actually, started Lipitor, when I went to go, see my provider, earlier this month. And I could say, oh, Dr. Smith, started it, my cardiologist. Sorry, there's a little bit of delay. And I could, accept that in, and my provider upon my next visit will be able to see that and pull that into the system. And here again, this is where you can, your accounts, if they are connected, you'd be able to see any refills you're eligible for at your other, facility locations. Talked a little bit about test results before. Test results are accessible at this point near real time as they come in. This is both exciting and sometimes, a lot to digest as a patient. There's a lot of information that comes along with tests. Things are abnormal that we don't need to worry about. So I know it was mentioned before, but your provider can hold the results to speak with you directly if you want that. Or, you can look at these as soon as they become available. So your results are available here where you could jump into it and see what your result is and any of the qualifying information that's available. So just to give us 10 minutes, I'm just going to do one more area. Actually, let me say what I'm doing before I do it. Apologize. Obviously, COVID is a huge part of healthcare and has been over the last couple of years. And understanding that there is an activity within Mount Sinai now to provide patients with any of their COVID-19 related information, specifically around vaccines and testing. So you could see up here, there's a quick link. Oops, sorry about that. It looks like a little QR code up at the top where you could jump into see your information about your vaccines, how, if you've had them, if you've had any testing, it would be here as well. Even if you have not had your vaccine at Mount Sinai, you'll have this box here where it says, do you want to request an update? And what this does is it actually is pulling from New York State's registry where everyone's vaccines are registered for COVID-19. And it allows Mount Sinai to see that information so that we have that on file for the next time you come into the office so that we could see that. Also here you could see just some quick options around education as well, for the vaccine. You can also upload this to your Apple Health wallet. This allows you to, not so much anymore, but for places that do require proof of vaccine, you can upload it directly to the Apple Wallet. You can also download it or export it, like I mentioned. So it is 12:51. I want to give a couple minutes for any additional questions. There's a whole lot more functionality, within this menu, such as downloading your results or updating your insurance. But again, I want to give enough time for questions and to wrap up the hour.